So I'm going to be practicing doing the head to toe return demonstration, doing the best I can. So first I would provide privacy for the patient, acknowledge myself, ask them how they're doing, and introduce myself. My name is Taylor. I'm going to be your student nurse today. I'm going to do a head to toe assessment that will take about 20 to 30 minutes. Is that okay? And then I would have them identify themselves with their name and date of birth. And then I will ask them what brings them in today, where they're at, and what day it is. So my patient would be alert and orientated times 4. And I would ask them if they were experiencing any pain and if they had any allergies. So then I would move on and see if they had any signs of acute distress or any devices that they came in with. And I already did the alert and oriented times 4 in the wrong area. But then I would ask them those questions. And then their facial expressions, their mood and affect, and speech is appropriate for the situation. And then I'd move on to vital signs. I'm just having my paper here for a guide in case I get lost. So then I would move on to the skin. I would see that the color is appropriate for the patient's racial background, feeling and seeing that there's no incisions, wounds, or lesions, and then feeling the skin, the color would be warm and dry to the touch. The turgor would be good, and then I would check the nails for the color. The color would be appropriate for the patient. There's no signs of clubbing, and the capillary refill is less than 2 seconds. So moving on, I would inspect the head, looking at the hair if there were any infestations or lesions of the head. And then I would assess for cranial nerve 5, which is the trigeminal nerve, for sensory and motor. So for the sensory, I would take a cotton swab and rub it against their face, and they would let me know if they feel it. And I would state that it would be intact. For the motor, I would assess the TMJ, have them move their jaw up and down, side to side, to make sure that is intact. And then I would move on to cranial nerve 11, which is the shoulders. I would have them shrug up and down and feel that they would resist and turn their head side to side, and let them know that and state that that was intact. So then I would move on to the eyes. So I would assess for any drainage, redness, or lesions of the eyes. Then I would look for the conjunctiva and the sclera. The conjunctiva would be pink and moist, and the sclera would be white. So then I would take out a pen light. I would assess, shine it on their to assess for perla. Equal pupil size would be like 3 millimeters. Equal round reactolite and accommodation would be present. And then I would perform the 6 cardinal fields of gaze, assessing for 3, 4, and 6 cranial nerves, and those would be intact. So then moving to the ears, I would assess for any discharge or deformities of the ears and look with a light. I would assess for cranial nerve number 8 with the whispered voice test. Whisper something to their ear and they would repeat it back to me, so that would be intact. And then I would move to the nose. So I would be looking for any deformities of the nose, and if it was symmetric, I would look up at the symptom if it was deviated or not. I would assess for patencies of each nostril. I think that is that. Then moving to the mouth and throat, I would have them open their mouth, stick their tongue out, and say ah. I would assess for the gag reflex, put a tongue depressor. Then I would assess for cranial nerves 9, 10, and 12. And I would have them repeat words light, tight, dynamite. And then assess that the lips, the gums, and the tongue were all pink and moist. Moving to the respiratory system, I would see if any ascellary muscles were being used. Then I would listen to all the lung fields, anterior and posterior. I believe that is all. Then I would move to the cardiovascular. I would palpate the left and the right carotid arteries, not at the same time. They'd be equal to plus. I would lay the patient down at a 45-degree angle and look for signs of JVD. I would have them turn their head to the left. Then I would assess for any edema by looking at the arms, legs, hands, feet. Then I would listen to the 5 different areas for the heart sounds: the aortic, pulmonic, Erb's point, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I would listen with the belt and the diaphragm as well. Then I would palpate the radial pulses. And then I would assess for the the dorsalis pedis pulses, and then the posterior tibialis. Then moving to the gastrourinary, I would assess for the contour and symmetry of the stomach, the abdomen. And then I would auscultate the right lower lobe, or right lower quadrant, left upper quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. And then I would palpate, assessing for tenderness or distension. And then moving to musculoskeletal, I would assess the upper and lower extremities of the joints for the for symmetry, contour, and bilaterally. I would assess the range of motion of the upper extremities, the major and minor, like the shoulder or the wrist, moving them up and down in a circular motion, side to side. And then I would do that with the same with the lower extremities, with the knee flex and extend, and with the feet. and then I would assess the sensory function, down the arms, the legs, if they could feel that. And then I would assess the strength of the upper extremity and the lower extremity, having them resist against my hands. And then I would assess the gait when they have walked in, if there was a normal gait. Then I would close. I would reassess my patient's pain level, if they need anything, if I lower their bed, lock it, have their call light, and thank them, ask if they need anything, and then perform hand hygiene, and that is it.